Good morning, Dr. Ericka Mizuta back again with Recover Healthcare. So I just wanted to do a quick video to explain to you something that interestingly just happened to me when I went to the dentist office. And these are things that you need to be looking out for your health to know what's actually going on with your body. So I went to get my teeth cleaned and my dentist has a panoramic x-ray, which she did to check for cavities and, to see how your teeth are doing, roots, all of that. So I'm looking at the x-ray and I know what I'm looking at. And you can see your carotid arteries in a panoramic x-ray. I could see my arteries and I could see that there's some blockage there. Now, what's interesting is you look at me and you think, she's healthy. She's a 43-year-old person. I work out 4 to 5 days a week. I lift a lot of weights. I run, I hike, I'm super active. I'm a normal body weight, yet I have blockage in my carotid arteries. So having seen that, one of the things that I've been doing is that I have a Dexcom sensor on my arm right now because I'm tracking my blood sugar. I do have a family history of type 2 diabetes. I'm not diabetic. I know that I'm not because I have been doing finger sticks to check my blood sugar. But I also have noticed that when I do check my sugar levels, especially because I like to intermittent fast, and it could be after a 12 to 16 hour fast, my blood sugar levels are a little bit on the high side of normal. So normal right now is considered anything under 100. 12 to 16 hours of fasting can give me a reading of like 98, which started to concern me a little bit. And that's why I put the Dexcom in, is because I really wanted to see what was happening with my health. So what a lot of people don't realize is that blood sugar levels, cholesterol levels, blockages in your arteries, it's all connected. When you have high blood sugar, what happens is that actually causes inflammation and destroys the inside lining of your blood vessels. When there's inflammation in there, any cholesterol that you have is able to better stick to the inflammation, which can create blockages. So, even if your cholesterol levels are normal or not even that high, you still might see some blockage in there. Now, a little bit of that is a normal process, but there comes a point where it's not normal. So what I'm in the process of doing right now is that I just ordered a CBC complete blood panel. And so I'm gonna get all of my cholesterol readings from that, blood sugar readings, an A1C, because I wanna see what my cholesterol level is. So once I get that information, then what I'm gonna do is I'm gonna go and I'm gonna see my primary care doc, who's awesome, Perlman Clinic, San Diego, great shout out to them, I love them. And so I'm gonna go see my primary care doc and I'm gonna get a referral, most likely to a cardiologist, who is then going to look at my carotid arteries and let me know about that blockage, what the percentage is. I can visibly see on the x-ray, and I'll attach it here, that it's not fully blocked. I have no symptoms of carotid artery disease. A lot of people, when you start to have symptoms, I have patients that when they put their head back and they have a blockage, they will literally feel like they're gonna pass out. They'll start to see stars. They have memory issues. I don't have any of those problems. So I'm catching this in a very early stage, but I just wanted to let you know that it's interesting because, you can look at somebody from the outside and think they look totally healthy, but unless you really know what's going on inside your body, you don't know. This is why we saw so many people with COVID in the beginning where they died and people said, oh, these people are so healthy, I can't believe they died. Well, just because they hadn't been diagnosed with something doesn't mean they were healthy. I didn't think I had blockage until I saw it on that x-ray when I got my teeth cleaned. So, it's interesting how people discover health issues sometimes, but you really have to be proactive in going and getting your cholesterol tested, getting your blood sugar tested, going and getting physicals, getting mammograms. I mean, all these things are preventative, but you need to do that. And also back to getting your teeth cleaned, a lot of people don't know that the bacteria in your mouth, the bacteria that causes gingivitis and bleeding gums, that actually causes heart attacks and strokes. It actually can also cause issues with joint replacements. And I have had a patient in the past that went and had his teeth cleaned, and then basically his joint replacement started to liquefy and he had to have surgery again and have that fixed. He had to have the whole replacement, the knee replacement taken out and put back in because of that bacteria. So you really want to be careful with your body and make sure that you are doing everything you can to be optimal health, because this is how you're going to live longer and just really be healthy. So I'll give you a follow-up once I have my blood work done. I'll let you know what my panels look like. As a healthy 43-year-old who is a normal weight, I can guarantee you that my cholesterol is probably a little bit high, which is why I'm seeing those blockages. And the thing about the blood sugar is that with all the new research coming out, it looks like fasting blood sugar levels need to be more between 70 to 85, and I'm on the high side of that. So that's probably one of the things that's causing my issue. So I'm really gonna be looking at my diet and how my body responds to food. So just so you know, you might wanna go get your teeth cleaned, look at your x-rays, have your dentist look. If you have a panoramic x-ray, you may see some coronary artery blockage, which is an easy way to diagnose that. And then you definitely need to get to a doctor and have a follow-up and see what's going on there and have some follow-up blood work done. So there's my other service announcement for the day. Just because you look healthy doesn't mean that you are. You really have to know what's going on inside your body. All right, guys, be good in health.